All right, so for a musculoskeletal assessment of the baby, you first again are going to look at them. You're going to see kind of what their tone art is, which I know we talked about a little bit in the neuro assessment, but you want to kind of see how they are holding themselves. You are going to, see if they have active and passive range of motion. You can move, each of the joints around and make sure that everything moves the way it needs to. That you don't feel any like shortening of muscles or things like that, or excess tension when you are moving a certain part of the body. You are going to assess for any skeletal issues. We talked about a clavicular fracture in one of the other assessments. This is also related to musculoskeletal, and it is something that does happen, especially in some vaginal births. As the baby is passing through the birth canal, that clavicle does fracture. Typically, treatment isn't necessary, and it heals on its own, but it's just something to kind of keep in mind. So you can feel around and see if you feel any abnormalities, and that is how that you would notice something was going on. Also, in looking at the baby, you would look to see if you see any abnormalities. So in the hands, sometimes there can be extra fingers or, missing fingers, things like that you want to look around for. You also might see some bowing of the legs. You might see some club feet. You could see some hip dislocation if, one side of the leg is longer than the other side. That's definitely something that you would want to keep in mind. Depending on the position the baby was when they were born or how they were in utero, a lot of the time they kind of like to stay in that position. So if they were a breech baby, you might notice that they kind of prefer to kind of have their legs up like this. As long as there is a complete range of motion and they are able to move all of their, extremities, this isn't necessarily something that would need treatment. But if there was something more serious going on, if they didn't have that full range of motion, then that's something that you would definitely want to look into. So you're going to look at the baby, kind of move everything around, make sure they're able to move everything around themselves, which most babies are active, and you should be able to see them at least, a couple of times moving their arms and legs and all of that stuff. So these are all things you'd want to look for. And then you also would want to turn the baby around and look at their spine, make sure that it looks straight. You don't see any curvatures or deformities there as well.